Good day, and welcome to Connecting with Kathleen. We're a show that highlights local nonprofits, bringing information to the residents of Roaring Fork Valley about services that are available to you. And today I'm excited to have the Behavioral Health Leadership Group here, two of them, two of my great friends, Michael Buglione,
Hello.
Sheriff for
Yes.
Pitkin County, Lindsay Lupow, who is the Program Director at Headquarters. Welcome.
Thank you.
Yeah, so let's talk about the Behavioral Health Leadership Group. What is that?
Who wants to take it? You want me to take it?
I'll run first, and you can fill in the gaps.
Okay, cool.
It was a group. And correct me where I'm wrong. Headquarters kind of saw an issue, which I think we all recognized. I think Headquarters finally just got the energy to wrap their hands around it to bring all these entities together. Now, we have so many resources in Pitkin County for people suffering from mental health issues, substance abuse issues. I'll go as far as homelessness. And in my mind, there's so many resources out there that it almost gets confusing for people. I think part of this behavioral health leadership group is to simplify that for people who need those resources in Pitkin County.
Yeah, I know I've had people say, I don't know where to go. I need this kind of help, that kind of help. And if you go online, there are so many nonprofits.
Mm-hmm.
Which one do you choose? So how are you guys going to address that?
I feel like, so also, I do want to take it back just a little bit to where Paradise Paradox came into the Valley. And with Paradise Paradox,
Can you explain what that is?
Paradise Paradox is an incredible film, super powerful, and it goes into rural mountain communities. This one was in Eagle. They also have sister mountains, so they talked about their other sister and different ski mountains that are working well together. But it's gut-wrenching and really hard, and it talks about a lot of like the loneliness and why we move here. And this screening was at the Wheeler, and a lot of people attended from our community. And then there were opinion pieces put into the newspaper saying, you know, no one's doing anything for mental health here. And us in the behavioral health system and, you know, us knowing this work, we were like, that's just not true. And we know how much incredible work is going on. And unfortunately, therein lies the last 30 years of what has happened is when something is found to be a gap and people find out about it and they get really creative and they're like, well, I want to start a nonprofit. I want to address this gap. And so then you have this fragmented system of care. So I would say to then move that into what you're saying is like our three things is really to create a better system of care between the organizations and to build the system where the organizations are working together instead of in competition, because we know with nonprofits that it's competition. To also address the language and the referral network between these organizations, because us being involved don't even know what everyone does or the points of entry. Right. So to find that point of entry and how to refer, and then the funding, and us being able to come together and make some bigger moves and maybe secure more funding as a collaborative than we could do on our own.
And I'm going to lean on you for this answer, but let's go back to the very beginning. Behavioral health, why are we calling it behavioral health and not mental health? And again, I'm going to lean on you for that answer because you probably know that better than I do.
I feel like it's exactly what you were saying in the beginning. There are so many things that go into mental health. And behavioral health as a whole, when you look at it as from substance abuse, from homelessness or you know, displacement, from food insecurity, financial distress, there's so many different things that go into mental health in its entirety. So when you open it up to behavioral health as a whole, and we can all work better to understand what is causing the mental health issues, because it's all part of that behavioral health, that's why I think doing behavioral health is a full scope.
So behavioral health is kind of like the umbrella over all the separate issues there, almost like the group is trying to get an umbrella over all the nonprofits. So we all work together and we don't, duplicate services, that type of thing also.
Yeah.
So who's involved with this group?
Go ahead, Lindsay.
So we have a good group of
We do.
people, and I feel like when we first started it, we wanted to like really go big. And with that, you also have a lot of ideas. And so before we went too big, we decided let's keep it somewhat smaller with really good stakeholders, government officials. We have the Pitkin County Sheriff's Department, we have the Aspen Police Department, and then you have public servants and community members, therapists, and then you have also the behavioral health organizations, and those are in different areas, so we make sure we're spotlighting that whole scope.
There's a lot of energy in the room when we have our meetings. Yeah,
Right.
it's good.
So what are some of the goals? What are we working on?
I think when I first meeting was it last January or December or
It's November.
was it November? My
Yeah.
goodness. I had in my mind like we're here to create. I think I said like a flow chart to help the end user navigate through the multiple resources that we have in Pitkin County, whether they're in Aspen or Mid Valley or Down Valley. And then as we kept going, it's like we almost need like a CEO over all these, and we can't because each one is their individual operation, whether it's a nonprofit or government or whatever it may be. So we're working on, again, in my mind, just making it easier for the end user who needs that help and doesn't have time to make 10 different phone calls or is not capable of making those 5 or 10 phone calls to get the right person to help them.
Right.
I would say it's those three things. So you need, and we serve multiple areas. So most of all of the organizations, the behavioral health organizations in this area serve Aspen to Parachute. So you're over multiple county lines. So while we're starting in Pitkin County, we also have to consider the multiple county lines. But those three goals still remain the same of the system building and creating a better system. The navigation is part of that, I think, within how we work together and the common language that we're using and not being in competition with each other instead of being very collaborative and understanding what everyone is doing. And then, so that's kind of the two-part referral network, common language and systems building, and then that funding piece. And the funding piece is extremely important because this isn't the first time something like this has happened. But what always stops it is the funding. It's being across multiple county lines, not having enough funding from all counties, organizations feeling like, well, am I going to fund this? Like, is our organization going to fund this full effort for everybody's benefit? And so I think that funding piece, not only does it help serve the organizations and the community and the community members, but it also helps to serve the donor base because they don't have to pick and choose. And right now you have how many nonprofits?
It grows every day, I think.
Yeah.
And so we're all fighting for the same dollars. We're all going after the same donors. And so that's what draws the competition between the organizations. And so if we can come in together and be collaborative and say you give to one place and then we evenly distribute, or if we see a need that is, more like important and something that we want to tackle that year, we can say, okay, this is where the funding needs to go because we're communicating and we know. Yeah.
All right. So I am a member of this group, and what's fascinating to me is it is a dynamic group, and it's all volunteer. Can you speak about that a little bit?
Yeah, I think the people at the table, again, bring great energy, great ideas. It's a diverse group from Aspen's mayor, Tori, to, again, law enforcement and clinicians.
And different nonprofits are represented there, and never
so
once
many.
have I seen a competitive issue there. Everybody seems to want to
Everybody's on the same page.
bring it together, which I think would speak to the donors if you could donate to one big fund and know that it's going to be distributed throughout the behavioral health needs in our community might be very appealing versus just one area.
Yeah.
Yeah, and I think that that just goes to show how much we truly care and want to make a difference and how much good work is going on out there. Like, there are people really trying to move mountains and really showing up for this work. And I think that in hearing public or, you know, community members make opinion pieces saying that nobody's doing anything, I think it honestly motivated us more to be like, but we are, and we want to, and we're going to take this seriously.
Yeah, I think that study that was completed 30 years ago created the need for all these nonprofits, and now I think there's this other bigger need to kind of coordinate and bring everybody together.
Kind of like a continuum of care almost across the board, right? So that sounds wonderful. So as going forward, I don't think a lot of people in the public know what this group is doing. This is one of the reasons I have you on the show.
Thank you.
Is that, you know, people call in, talk to us, that this is happening and you can donate and help out. Who do you think, or how will this impact our valley when we get this all put together?
It's just going to help all those that are struggling. It's going to make it easier for them to get the help they need, the resources they need. And struggling looks different for everybody, right? So you don't have to be down and out and on the street to be struggling. You know, you can live in a nice home and still be struggling. So I think it'll just make it easier for all, everybody in the community to get the help they need.
I would say and echo that and say and I've always been like a top-down approach person, and I feel like if you're not living it, you can't expect change. But like, I think it also will do that for the organizations, for all of us communicating. I've learned so much about just what the Sheriff's Department does and PACT and the police department and how they're responding to calls and how things are done. And when we all know that, when all those that are involved know the steps and have the language that they're using or talking things, then that goes directly from me. I hope I didn't hit my mic, sorry. Goes directly from me to the community member, because then I'm not confused. And I can tell you that being in the, you know, this sector and the behavioral health sector, I've gone through issues with my, you know, with my family, with myself. I didn't know, and I'm in it. So how do we expect anyone else to know if we don't know? It starts with us collaborating.
Yes.
And you said, you know, that it takes a village, right? Well, now the village is being built, and it's local, and there'll be people, faces that you can go to and know and familiarize yourself with, which I think is a great idea. How do you envision this to look?
I really hope, like my envision is that we start with a really good system. You know, we're going to do some system building and see exactly what has worked, and, you know, reach out to other areas that have done this work well within their communities, take what they did well and build that here, with knowing we're a very different area. And so taking our individuality and putting that into our group, but then really taking that and expanding and making sure that we are hitting Aspen to Parachute. That's like so important to me, because this valley is so different, yet we're so connected. And I think that if we can get this out to everyone, it's going to be so impactful to what really is the mental health crisis we've been in for decades, of having high suicide rates and people not really understanding the system or knowing where to go.
Yeah, Aspen to Parachute, that brings in a diverse population.
It is, because
right?
the counties are very different, even if we look at law enforcement.
Yes. So, you know, to group everybody in and have everybody thought of in that diverse group from Aspen to Parachute, it's a heavy lift, but I think we're pushing the rock uphill, and we don't want to leave anybody out. So, you know, and I think we're constantly thinking about, do we have everybody in mind?
So many people work in Aspen but live down in Parachute
Yes.
Rifle, and so we want to make sure they're included. Do they get help in Aspen after work, or do they get help in Rifle, you know, before they go to work? You know, to help them get that unified, and you know, knowing all those services down Valley, which I know I'm learning still. If people who work up here and come to me with hospitality, where do I go? I'm like, I'll get right back to you.
Right.
It's hard when you're over we have a very big area we serve. And so being educated on that is really hard as an organization that is doing one thing. So like, how do you look at all? So I think having that common language in these meetings and us communicating and, you know, developing this together, you learn so much more, and just you can really help a lot more people.
Could you talk about how far the group has come and what the next steps are?
Oh, boy.
Come a long way.
We've come a long way, yeah, from a group of us sitting around a table, and where do we begin? I think bringing in Tessa the last few meetings was a big help to really...
And who is Tessa? Want to describe her role?
She's a facilitator.
Facilitator.
Yeah, so us not having us direct it, and instead of having somebody that's completely outside of it directing and facilitating.
Yeah. I think that's been very helpful. But we had to do that hard, difficult work of just getting our ideas out there, and then I think she came in at the right time, and it just is moving us forward.
She gets us when we're stuck and we're just like talking back and forth, and like really continues the work forward, which I really appreciate.
For sure.
And I think that also having, you know, we are taking it seriously of like, how can this move forward? So having, you know, legal counsel look at like how we can do this across the organizations and it be effective and no risk, and all the legality of having a group like this formed with multiple people that represent different organizations. System building, you know, having experts in system building coming in that, you know, have years of this type of work and experience in it, teach us like, how do you system build? So definitely a lot of progress.
And we want to remain consistent as well with this large area we're covering. You know, so there's some homework for all of us to do. You know, if someone calls a welfare check-in on someone that they're concerned about, does Garfield County, Eagle County, and Pitkin County kind of do those welfare checks in a similar way? Right. And it turns out we do, and I knew we did. But we want everybody to know that calling a welfare check for your friend. Don't worry about what they may have in the house, who they may be, or whatever. But get the welfare check done and make sure they're alive and going to stay alive.
Right. And then making sure there's follow through for the welfare checks.
Yes.
And having this big umbrella of services will help. So it sounds like we're kind of modeling a little bit after Vail Behavioral Health, what they've done.
I feel like taking a lot of what they have done really well, and remembering that we are a very different community, and that theirs is Eagle Valley, which is, you know, a much smaller area that they can focus in on. But also, we just have different organizations and different, we're very different structure. And so taking that, a lot of what they have, they built as well, where a lot of what they have, we already had. Right. So trying to figure out how to support those and be inclusive and collaborative and, you know, really take that great work and learn from it and make it better.
Yeah, because their model was based, you know, Eagle Valley Behavioral Health was based off the Hope Center model initially.
And Building Hope was based off of really the whole preventative side that's going on here with headquarters. There's a lot of overlap.
Yeah, lots of overlap. And I'm excited. I'm really happy to see that the work that's being done to, again, make it easier for the end user.
Right. And I feel like this group is kind of a role model. The Surgeon General has said the #1 epidemic is loneliness. People are not connecting. And so how can we get people to connect if we, as agencies and, individual practitioners are actually not connecting and working together. I think that's a very exciting thing to see, being in this valley for so long, and finally, people are wanting to talk to each other and say, what are you doing? Oh, I'm doing the same thing. Why don't you keep that and I'll take this?
Yeah. Let's knock down the walls, right? And
exactly.
and work together.
And I think that actually is something like there has been bad blood within organizations. And you have to call that out. Like you have to say, listen, we haven't always played nice. There has been, competitiveness between, and how can we change that? How can we start to like really connect, to really support, to really collaborate? Like collaboration is thrown out there all the time, and I think that word is a little overused now, but like how can we really work well together?
I'll say 5 years ago, maybe a little longer, I don't know if we were able to get the people who are at the table to the table.
I don't think we did,
Right? And it's really nice to see that. That everybody's like, okay, we need to work together and connect.
Yeah, so the caretakers need care too, and that's also what we're doing, is taking care of each other and making sure that we can provide those services and spread them out. I know there's some agencies that may have a big pocket of money, which may be only available to someone who goes to that specific agency, but they can't carry all our counties here and every single person. So how do we open that up so every single resident in the valley down the Parachute can benefit? Something I'm looking forward to.
And we're going to
seeing.
grow because we have people living in Grand Junction that work in Pitkin County.
Yeah.
So yeah, it's going to grow.
So how can we effectively really manage a behavioral health system if we're not collaborating and doing it together? Like really, how can you?
Yeah.
Right. And people move up and down the valley all the time.
Oh, yeah.
All the time. Talk to our donor base. How can we get them involved?
I can take that one first.
Please.
I mean, I really feel like we have to get this system built, right? We have to get this system built. And I feel like our donors need to know like what we're trying to do. I think it oftentimes can be hard as a donor to be like, I have to choose between giving to A or B. And now if we create this pathway where we can fund and have donors that fund behavioral health for our valley in general and know that it's going to be lifting up the entire community, I feel like that's really exciting as a donor. And you know that your money is not only going to go to behavioral health, but it's going to make a larger impact, a much larger impact, because we're all working together. So I feel like as a donor, personally, I mean, I donate. Oh, I hit it again. I'm so sorry. But as a donor, I donate to organizations here, and I feel torn all the time because I'm not, I don't have millions of dollars to just be giving. And so I'm always like, well, what do I really feel passionate about this year? Is it crisis or is it prevention? Is it, substance use? Where am I really feeling it? I don't like that I have to pick and choose.
Right.
So it's kind of like taking the current mental health fund and greatly expanding that.
Correct. Yeah. Yeah.
Can you speak to the mental health fund?
Yeah, Mental Health Fund is a headquarters fund with Aspen Community Foundation, and we provide therapy for those that otherwise may not be able to afford it, and it can be uninsured, underinsured. It doesn't matter really, as long as you say you want therapy and you want to find a therapist, we don't want to turn you away. So it provides up to 10 therapy sessions, and it can be between Aspen and Parachute. So that is a huge part, as I think we know, like there needs to be a fit between the therapist. And oftentimes when you're in that, place where you're having a financial hardship, you're sent to one place and said, these are your therapists you get to choose from.
Right.
And it doesn't work. And you're like, oh, I didn't like that therapist, so I'm not going to do it. And so having this fund is really important because you get to go to any therapist and be like, hey, would you take the mental health fund? And, we try and be pretty competitive with rates, also knowing that like it is a fund and it is subsidized therapy, so it's not going to give the therapist the exact dollar that they ask for, but It's an incredible fund that I really wish the entire valley from Aspen to Parachute knew about.
Yeah, I do too. And it gives the client a greater resource. A lot of times they'll be told to go to one agency, and then there could be a 3-week waiting list where there might be a private provider who will take that and say, I can get you in tomorrow.
Yeah.
Which I think is a great advantage. And to expand that funding to cover other things like food diversity or homelessness, or if we can expand that to take all of the behavioral health issues that we have in this valley, it'd be pretty amazing.
Pretty incredible. Yeah. And I think that it just goes to show this continuum, right? I think you said it a couple times, just how important it is of where do you come in and then where are you referred and how can you really take care of yourself consistently and not just giving up, not just saying, okay, I don't want to keep doing it anymore, I'm just done. There's always a way in, but it's really hard to navigate here.
Right. And then I think also filling the gaps, maybe more childcare programs, intensive outpatient programs. I don't think we have a need there, I believe.
Yeah.
Agreed.
And if the group comes together to identify more grants, we can probably pull more providers into our umbrella of care.
Yes. Yeah. I mean, I think that we do have family physician offices and some medical offices and the Valley Health Alliance. So we are thinking in that way of from doctors' offices to private clinicians to substance abuse centers to, I mean, it really has to be inclusive and all over, yeah.
That's what we're working on. Well, I want to thank you two for being here today.
Thank you for having
we're
us.
looking forward to having you again, and we're a little bit further down the road.
Sure.
And I thank the audience for tuning in today. If you have questions, can they contact either one of you? Where should we send them?
Yeah, definitely. You can contact me, Lindsay, at headq.org, or just go on to headq.org, and there's a button that says Contact Us, and you can always just put in your name, what you're looking to talk about. We get to those within the next 24 hours.
And you can find me through the Pitkin County Sheriff's Office website. Thank you.
Right. And you can find me with Hospitality Matters on Facebook or my personal website. So we can all answer questions. We're here for people. Anything you'd like to leave us with?
Stay healthy. Holiday season's coming up. Slow down on the roads.
Yes.
Don't drink and drive, please. and enjoy the amazing snow that we have on the mountains already.
Thank you, Michael. Lindsay?
Thank you.
I think just really holiday season and it being just this time of year can be really hard on a lot of people. And so I feel like just reminding us to be kind, to really reach out, and that this connection piece, all it takes is a text to a friend, a call to a friend, and if you just send that one thing, it can make a huge difference. So just, I always say be kind during the holidays.
Yeah, and I'd say easiest gift to give is kindness. Spread it everywhere. So thank you guys, and signing off, wishing you health, happiness, and healing. Thank you.
Thank you.
Thank you.